All of you heard about all the earlier points. What I want to talk to you about is the value creation. So the value creation is taking the data to the transformation. When data gets converted to information, that is when we stop dealing with a patient and look at the patient's disease. That is one aspect of it. So, and when we convert this disease and we bring in the external knowledge that we have, the knowledge that we have from the patient's genomes, the external availability from a disease surveillance system and so on, that gets converted to value. And when you are doing with the knowledge management, that gets converted to knowledge. When you're dealing with knowledge management, you're dealing about care management. This is where you're talking about the preventive care that you can do, the outcomes and the how to manage the outcomes and how to put value on the outcomes and so on. And on this, in the same pyramid, I have put information on the areas of the insurance also, because that's the key. Because in a business of healthcare, there is the person who is paying for all this. So they have also got to look at it from that payment perspective also. So that's a key to the whole thing. And finally, how do we create value? The value has to be created for all the stakeholders in the industry. We have the patient is the stakeholder, the care provider is the stakeholder, the person who is paying for all this care is the stakeholder. So everyone has to create value. For the patient, if we are able to maintain wellness, if we are able to predict what the future of the patient's illness is going to be, that is value for the patient. For the hospital, if they are able to predict what is going to be the cycle of illness, what type of patients are we going to expect, how do we manage the hospital's limited resources in providing this value for the patient, that is going to be the value. For the insurer who is going to pay for it, or even for the patient who is paying it out of pocket, the value is how do you decrease the cost of care? How do you ensure that your out-of-pocket expenses are minimal? That is going to be the value for all these stakeholders. So the bottom line is that data by itself is no value. Taking it through the transformation process, ensuring that every point of the transformation is creating additional benefit for every one of the stakeholders is the key in the transformation and creating value. Thank you so much.
Thank you, Ramesh. We had interruptions. We had to get off stage. We came back in and got a little irritated. Then when I was reflecting on, for those of us who been through several hospital information system implementation, I think this is most typical of a hospital information system. The thought of a hospital information system that gets us what Vijay Raghavan brought us back, very precious points about the patient experience. Very precious. It brings us back into what is design and how is design and what is it that needs to be effective. Sandeep gave us a good insight in terms of what is build versus buy. You got to understand what is right for your company, whether it's a build strategy or a buy strategy. Hardeep put us back to basics. Figure out your technology, understand your technology, because technology can fail too. That doesn't mean it should deter us. It's just a pointer towards your design. Get your act straight, understand what you're doing. And wonderfully summed up with Ramesh. He told us that while you do a powerful implementation, it's about aggregating your data and creating that value, predicting. The next level of getting data out is that wonderful predictive analytics. Thank you very much for being with us. We had a great session. If you have any questions, we'll take it. Otherwise, we'll be available. No. Yes, please. Can we get a mic?
Hello. I have this question for Mr. Chatterjee, who spoke about Oracle implementation. Mr. Chatterjee, you mentioned that during stage 2 of implementation, you came up with a middleware to interface the disparate applications. My question is that, was it based on any standard, or the middleware was just your concept?
No, the way we do the development, we follow standards. Because what it needs is any high school grad who just knows Java, he's able to do it. So it's an open standard. I will not say an open standard. It's very easy to learn, because if you go for some kind of specialized software, you will have certain proprietary language which is difficult to learn. But the way we develop it, it's Java. And any engineering, any high school graduate knows Java. And we have our own standards, and it's usually the industry follows those standards.
Okay, next question, like from your experience, do you think the international standards like HL7, which are like proven messaging standard, can they be applicable to Indian scenario, or do you think there is a need of customization?
See, the way it happens is India business, what I have seen is, it's complex in the sense that our regulations are slightly different. So what works best for the rest of the world may not work for India. Because if to give our example, we have something called the India localization. We have built a separate part of the code for India itself. So there are challenges. It does need some kind of a customization.
Okay, thank you.
I have a question for Vijay Raghavan. Your presentation was excellent. The idea of transforming the written thing to a digital thing. But the question is, how foolproof or how successful? Because as everybody knows, the doctor's handwriting is excellent, right? So how could we, convert? I can write A in a different way. You can write an A in a different way. So how do you tackle that problem? How successful was it to implement it?
Just before he answers the question, just remember your next prescription has to be written.
Okay, put it straight. The success of, I got your point. In fact, we did a 4-month pilot, and the major struggle was to trap the handwriting. It's so difficult to recognize the handwriting and pick it up and convert it into XML scripts. Now, the way I look at success is little different to what you said. One of the problem in a hospital environment or any provider setup is you enforce a technology and it's so difficult for them to adhere to, then you try to incentivize, then you try to add more packs, and it doesn't work. Here was the attempt to start something minimal and try to see, not to keep it perfect, to keep it good, and see some kind of results. And I'm in a 4-month pilot. When we did, we were about 65 to 70% accurate. It required training. Now the idea was to do that and then move into the next technology, which we in fact we adopted. So the compliance gets better. Everybody understands why technology is brought in. Otherwise, the stakeholders at the very grassroots level, the doctor or the nurse, they become very alienized with the technology. Now, for the second thing which you brought about, in fact, when I was reading through this, the pen and paper going back, the Medical Council of India, and in fact, there's going to be a lot of pressure being put on doctors to prescribe using capital letters, now, which is going to be a mandate in couple of years' time. Now, when that gets into picture, life is great. You keep the doctor do what he was doing, get it done in caps, transcribe it to XML, and don't worry about the rest.
Okay, thank you.
Hi, I want to address the question on the standards. Sangeeta earlier said that she loves a disagreement in the panel, so I'm going to give Arvind that same opportunity. I have to disagree with Sandeep. What I want to say in summary is that if we want to have world-class healthcare, we need to adopt world-class standards. Thanks.
Probably we're going to close this session with that disagreement. It's nice to disagree, but I passionately call upon all of you who have not signed the Cyberabad, Hyderabad declaration to please do so, and please volunteer to participate in our subcommittees so that we can actually find an answer. And next time we meet here, we're not going to disagree, but we're going to emphasize on what we agreed and actually share those learnings. So please do participate in those subcommittees. It will greatly help us and the industry, all of us together. To our panelists, thank you very much. Apologize for the inconvenience that was caused, but thank you. It was wonderful having you with us.
Thank you so much, sirs. This brings us to the commencement of session 12, which is the one on the ICT and healthcare in the Indian scenario. Our speakers for the same are Mr. Shankar, Mr. Gyanarajan Pradhan, and Dr. T.V. Gopal. Let me introduce Mr. Shankar briefly, who is going to be our chair for this particular session. In 1994, Sri Shankar founded AMI Germany and AMI India, which is located in Chennai. and the company started as a manufacturer of complete motherboards, positioning itself in the high-end segment. Its first customer happened to be PCs Limited, later known as Dell Computers. Shri Shankar, everybody. Our next speaker is Mr. Gyanarajan Pradhan, who started his career as a physiotherapist and lecturer in physiotherapy, and under the umbrella of Center for Health Information, Education, Research and Services, a sister organization of the Hello Physio, took initiative to start a healthcare helpline called the Hello Physio 24/7, which was India's first toll-free physio helpline, and Hello to Able 24/7, the toll-free helpline for person with disability and aging. And our next speaker, Dr. T.V. Gopal, is the chairman of the CSI Division 2 Software and advisor for the CSI Communications, a monthly publication of the Computer Society of India. He's an expert member of the editorial advisory board of the International Journal of Information Ethics, a recipient of Rashtriya Gaurav Award and Siksha Ratna Award by the Indian International Friendship Society, and the Indian International Publishing House has also selected him for the Best Citizens of India Award. Ladies and gentlemen, give it up for our last session and the speakers of the same.
Dear friends, I'm very happy to be here. I have enjoyed the sessions very much, and I'm sure that those of you who are here would have also enjoyed all the sessions during the last 2 days. My topic is healthcare IT return on investment. I would say that my talk is going to be focused more on how to improve return on investment, particularly focused on the healthcare IT industry.